Hey everybody, welcome back. I'm so glad to have you guys here, and thank you for being here for our listeners, our subscribers who are helping us to boost our YouTube numbers. We are so excited to be able to monetize YouTube, so make sure to subscribe and subscribe on any podcast listening platforms. I actually am joined today with a guest who I'm thrilled to have. This is Jacqueline Smith, and she is a cancer survivor herself, and she's from Jersey. She's a mom, so she and I have a lot in common at the moment, but she's got some really unique perspective on advocacy and how we as patients can actually advocate at a federal and a state level to see better things happen in the future of our disease and in the current landscape of what are we having to deal with as patients? What are the things that we struggle with, right? There's so many things that we have to deal with that we always talk in Facebook groups, right? Everybody is complaining that we have to deal with this, and we have to deal with the insurance hangups, we have to deal with the side effects, we have to deal with all of these hard things. Jacqueline's here to talk to us about how can we present those to the right people so that our legislators can help us do something about it and actually improve the future for ocular melanoma. So I'm thrilled to talk about this. So I think first of all, Jacqueline, do you want to just tell us about your experience in your disease and in attending what's called Hill Day, and maybe tell us a little about what is Hill Day?
Sure. So 20 years ago, can't believe it's been 22 years ago, I was diagnosed with stage 3 cutaneous melanoma. And I was just finishing up undergrad, and it's not particularly common for someone who looks like me to be diagnosed with melanoma, much less stage 3 at my age. I was preparing to go into graduate school also, and one of my focuses was health policy. At that time, the treatments were very toxic. There was one standard course, and I'll never forget, I was treated at a large academic center, and the oncologist said to me, the medical oncologist advised me to watch and wait if we didn't see any more disease once I'd had my biopsies, because the treatment was that toxic. So we did the watch and wait program, and 4 years later, I had a recurrence, same spot, same lymph node. So I ended up having a groin dissection. I was fortunate enough to qualify for a clinical trial, and I was treated down at Moffitt Cancer Center. And my surgical oncologist, Vern Sondak, is the person who started me on my wonderful advocacy pathway. And because of my background, I volunteered with the Melanoma Research Foundation, and I was part of their very first Hill Day. And I remember going to DC and being nervous about meeting with my member of Congress, not knowing how to write my bio to present, trying to beef up my knowledge on whatever legislative priorities the organization had. And I walked away from that event realizing that members of Congress and their staff really aren't familiar with their constituents' issues. The staffer I met with had never met someone who'd had melanoma. They thought that having melanoma meant you had a mole removed and nothing more. They didn't realize that it could progress. They didn't know that from my surgery and after having pelvic radiation that I was suffering from lymphedema. They didn't know that, side effects from immunotherapy could be lifelong, and that you have autoimmune disease that you can develop, and kidney disorders and thyroid issues. So I learned that it's very important to make sure that you put a face to your disease, and that you reach out and let these members know that this is important, and that most importantly, you let them know we need to dedicate money so that we have funding and research that is going towards our disease, and that we can make a difference, and that you have many more 20-year survivors like me.
I think that's so important, and I love what you say about put a face to the disease. And I think, for those of us listening, you guys, ocular melanoma is not something anyone hears about. It's not really talked about, even in the melanoma sphere. Most people, even with cutaneous melanoma, have never heard of ocular melanoma. And it's something that we are desperately trying to make it something that is talked about, and that our fellow, cutaneous melanoma survivors know that this is another type of melanoma. But the bottom line is that if the legislators don't know, then they can't help to advocate to allocate funding to the right places. So we're not going to go into all the weeds of the funding and how this all works, but can you just help us understand some of the basic areas of funding that are important for managing disease research and making sure that treatments are approved for rare diseases, things like that? I think you had mentioned DOD. Is there anything else or I guess you could just briefly outline what is DOD funding, and then talking about maybe NIH funding or anything else we think might be important.
Sure. So I think it's quite interesting that the U.S. Department of Defense funds a melanoma research grant every year. There are researchers from not only the U.S. but abroad also that can apply for funding. And this year they did have a uveal melanoma stream. So, yes, very important to know. So, there is work, there is funding. Under the melanoma arm, uveal is in there as well as mucosal, acral as well as cutaneous. So, years ago, we fought to get, it was $20 million that was allocated towards melanoma research. And another interesting thing is that as someone living with melanoma or a caregiver, you can apply to be a grant reviewer because they have to have the patient perspective. So, in addition to thinking about legislative advocacy, there's also advocacy where you're making sure your voice is heard, where you're making sure patient concerns are being forwarded. So, that's very important as well. In addition to the Department of Defense, the Centers for Disease Control, they also have money allocated towards melanoma. So it's, again, important there, fall under the federal umbrella. So making sure that your members of Congress know we need to make sure there's money allocated towards melanoma. We might need to make sure there's increased money and that no one is taking money away from the melanoma bucket to put it somewhere else. And then also the National Institutes of Health. So there's many institutes, and underneath NIH is the National Cancer Institute. It's one of the 13, and they focus on cancer research. We need to make sure that young investigators who are going into this space know that their labs will be funded, because one of the concerns for young researchers is going into an area that might be underfunded or funding will be withdrawn. When you're reaching out and letting your member of Congress know we need to make sure Senate budget dollars are allocated towards melanoma, we need to also make sure there's a carve out for uveal ocular melanoma, right?
Yeah, like within
Then, yeah, and then people know, okay, this is it. And by going into your member's office, you don't necessarily have to go to DC. If you can't make it there, if there's not an organization that is convenient for you to tag on with their Hill Day, all of your U.S. Congress folks, so your senators, your Congress people, all have regional offices. Within your state, if you can get to their office, if you can send a letter there and let them know, hi, I'm one of your constituents. This is my concern. These are some of the issues that I have as someone living with ocular melanoma. These are some of the challenges that I've had. And let them know, and there's more of me, right? And I know, Danae, one of the things that we talked about is I don't just want to survive. I want to thrive. These are the things I need to be able to not only survive, but thrive, right? We want to have a great quality of life as a survivor. So I think
no.
that's major, like making sure they see the face and understand this is real, this is what I'm going through.
Okay, so I think this is so powerful, and I want to continue more of the conversation of like what we can bring up as far as, you know, issues to bring up to our legislators, whether it's at Hill Day or, like you mentioned, in a regional office. And just to kind of break that down, a regional office, at least from what I'm learning in my own journey with like kind of trying to utilize the support from my state legislators and just at a federal and local level, is that you can go to your state legislative government website and you can see what district you're in based on like your zip code or your city, and then you see your representatives there. Because I know that when I looked at the website initially, looking at all of my representatives from my state was really overwhelming because there's like 75 just for my state alone. And I'm sure for like a state like California or Florida, somewhere where the population is larger, those representative numbers are even higher. And I just want to like highlight that it really is not as complicated as that, because you don't have to go and talk to all 150 of those people that are on that list. You have to find the people that are for your district. And one of the best ways that I've found to get a hold of who are my people is to call the local offices and to find out who, you know, whose district am I in if I didn't already know, and who do I need to directly contact that are, you know, they're responsible for listening to me. And I think that that's one of the things I loved about what you said earlier, is that it's important that we talk to our representatives because we voted them in and they work for us. Like, right. And so, you know, same as our doctors, right? Our legislative offices are held by people who've been voted in by the population. And that means that they're accountable to the population. Well, you living in that state means you are part of that group that they have to represent. And they actually want to do that, from what I understand. Like that you were saying, you know, it was always such a good thing for people to come in.
Yeah, so I worked for a U.S. Senator from New York, Senator Gillibrand, and I worked in her Syracuse office. So government, there's many layers of government, right? So you have the federal level, and as the federal level, your United States Senator, like for New York, she doesn't just have a DC office. She had 7 offices within New York State. So if you can get yourself to one of those local offices for your U.S. Senator or for your U.S. Congressperson, you can start with federal advocacy. And I appreciated when folks came in, because we don't know every issue. We don't know what's important to every constituent. So, but when you make an issue known and you make sure that we know this is important, then we can align with you and try to work to get your issue moved forward.
Castle Biosciences is a proud sponsor of this I Believe podcast. Castle's innovative uveal melanoma tests provide valuable information about the risk of your eye cancer spreading to help you and your healthcare team individualize the management of your disease. To learn more, visit castlebiosciences.com.
So after you have your federal, then there's your state level representation. So depending on what state you might have state senator, you might have a congressman or assemblyman, and then you have kind of more local level, municipal, city council type people. So you can advocate it at any level. And the good thing is if you speak to one person and maybe they can't help you at that level, they'll push you on to the next level. They'll let you know who you do need to speak to. They represent the people.
I think that's so important to reiterate, is that if you don't know who you need to talk to, just start calling someone. And if they don't know, they sure know where to send you next. Like, they will know where to send you if they are not the people who can answer your question. And I've had that experience, and and it's a little frustrating having to get, shuffled around from phone to phone, but in the end, you do get to the right person because they do know the system better than you. And so while Jackie's talking about, all of the different levels of government, and this can feel really overwhelming for most of us who maybe you're like me and you've only had one like high school government class to go off of for a semester of your senior year way back when. Like, you don't have to remember all of this stuff because that's what the people in the offices, that's what the assistants do, that's what their staff do. I guess I'm hoping that we can kind of alleviate your fears if you're listening and going like, well, I don't know government, so therefore I can't do anything. You can, you should, and you don't have to know it all because there are people there to support you along the way.
Very true. And the other point is, like we mentioned briefly, aligning yourself with one of your patient advocacy organizations. I know, Danae, you and I spoke, and ACIS works with NORD, and Melanoma, the Melanoma Research Foundation also does a Hill Day every year, and there's ocular patients that come along, and they'll help you. So you can get a template of how do you write your story, right? If you want to present, how do you craft your story to share? Because it's important. Like, again, I've lived in this space too for 20 years. My story is very long. When you go before for a legislator, you do have to distill it down to kind of the key points to make them understand how important it is. So, but everyone's there to help you make sure that you know what issues are important to the community, and then you bring forth your own and really how to make an impact.
Well, and like another thing to bring up too is that in using those letters, you can draft those letters or you can draft your story as a template. Maybe you're planning to go to Hill Day and then something comes up. You have treatment. You can't get there. You can still use that template of how would you talk to your representative and make a phone call or type an email. Go to the local office. Like, so
or snail mail it. You can put a stamp on a letter and send it to.
There's so many ways, and they
That's
all
right.
count. And I think that it's really important that we don't discount the other avenues that we could use for advocacy just because the one that we wanted to do couldn't work out or because it just wasn't accessible to us. But I like that you mentioned the couple of organizations. I know we brought up AACR.
Yep.
ACIS, of course, we have made it a pattern every February of every year on Rare Disease Day. There's a period of time that NORD goes to advocate for rare diseases. And ACIS, a Cure Site, has tended to go and participate in that and bring patients. I think that last year we had upwards of almost 10 patients who showed up and helped to advocate on Hill Day, and they all had a marvelous experience. They all said that it was worth it, and they would do it again. The challenge, right, in a rare community is that we're dealing with people who are, we're oscillating in where are we in our disease. We're kind of riding the roller coaster of treatment sometimes if we're in a metastatic diagnosis. And so as a community of rare patients, like, we have to help each other, right? We've got to help each other. And if you're listening and you're in a phase of life right now where maybe your disease doesn't take as much of your energy, doesn't take as much appointments, you don't have as much going on, then maybe this is a year that you could consider participating and reaching out to a Cure Site or NORD, the Melanoma Research Alliance, the Melanoma Research Foundation, just to see when are their Hill Days, when could you potentially go with them. And also, do they have any things to help you, be it a template or extra resources to help you prepare? But I know that some of the agencies or some of the organizations sometimes offer grants, like a travel assistance program, to help you travel there, so that it's not just on you.
Yep. And they also have advocacy toolkits so that you can go on and have a better understanding of what advocacy is, what might be expected of you. Also, the American Cancer Society, their Cancer Action Network, also has an annual Hill Day too. So that's another organization.
And just to clarify, these Hill Days don't all happen like on one day in the year, right? They happen throughout the year.
Yep.
Okay, so like I know, for example, we're talking about Rare Disease Day and Hill Day for NORD. That happens late February every year. They always do it. But these other dates, if for whatever reason February is just not a good date in your schedule, you can look out through the rest of the year and you can look for those other opportunities. If you have any questions, like of course, please reach out to these different organizations like A Cure in Sight, NORD, and just ask when are some of these other optional times that they could go and have patients who are helping to advocate. Okay, so we kind of got in the weeds there with like the best ways to make sure your advocacy can go a little bit further, which is still a good thing. But let's talk a little more about like, okay, what do you talk to your legislators about? What kinds of issues? Like, yes, it's important to put a face to the disease. We want to help them have a better, knowledge base that this is something that exists and it is a problem for not just you, but for more people they represent. What are some of the issues that you might bring to your legislative offices besides funding? Like we kind of covered a few of the things already. What are your thoughts there?
Coverage issues. So again, I think it can be personal, and I'll share one of my personal pain points, if you will, is I mentioned I have lymphedema, and compression stockings for lower extremity are not always covered under insurance policies, and this is a condition that is progressive. So if you manage it early, it can be contained, but if not, then it can be progressive and it can be extremely debilitating. So again, as someone who's worked in policy, I wonder, why wouldn't you cover a compression stocking rather than having to worry about someone ending up out on disability because of mobility issues due to this? And so that's something I've been working on. Again, the wheels sometimes move very slowly, but the squeaky wheel also does get the oil. So I have been advocating for years about this. And I go to Hill Days, I write letters, I call in to see what's going on. There has been movement, again, on the breast cancer side, making sure there's coverage, but it hasn't trickled down to all of us who have been affected by cancer. So that's one issue. I know, Danae, we were talking about the prosthetic eye and coverage issues there. That's a major issue. So for me, if I were someone living in that space or doing advocacy, that's one of the things I would write in, or write a letter. Even you can send pictures of, this is me before, this is me after, these are some of the challenges. Really detail what it's like to live and what it's like to struggle to get coverage for this. And make it known that this is an issue. And I'm sure that it's not one person in the community.
No, it's absolutely not just one person.
Right? And so there's also strength in numbers. So that's where, for at least on the ocular space, that's one area that I can definitely say would be something to push forward.
Yeah, so that's one option. And then I know just from kind of the noise in the community, you guys deal with scan coverage. Sometimes we have doctors who are submitting to say we need scans to monitor for metastatic growth, like even before metastatic disease has been discovered. Sometimes maybe you're one of the lucky survivors who's 15 years out from metastatic disease, and you're still trying to have those regular routine scans to watch for recurrence or new disease. And if you're getting insurance hangups with that, this is the kind of issue that like legislators need to know about, that we want the help and the intervention in those kind of private insurance companies to make sure that the needle moves forward, not backwards, and that we see the right coverage. Because we know that medicine is so complicated. Everybody's medical journey in the treatment of really anything is so unique and individual. And that's just one of the challenges of like, I think we talked a little about this, kind of the broken pieces of the system that are like, it's like, yes, we want the oversight. We want to have the legislation that helps to kind of normalize what's okay and what isn't. But the cost of that sometimes is that it's almost made too general, and then you have the specific pieces that fall through the cracks. And ocular melanoma is one of those diseases that the side effects of our treatments, the lack of coverage for scans, the lack of coverage for just treatments that we need to have because they're considered too new, that's a challenge. Like those are all just simple, examples. So really, if you think about what are the biggest pain points for you as a patient that you're dealing with, those are the things that you should talk about, that you should put in your letter, that you should make sure you bring up when you're talking to a representative. I think, just to highlight a couple other options, and Jackie, you can kind of correct me if I'm wrong in kind of guessing that these would be good issues for us in the OM community, is the lack of consistent care in a state, because we have 50 ocular oncologists in the country roughly, and then we have even less medical oncologists who are handling the metastatic patients, and we know that roughly half of the patients with OM we end up going metastatic. Like, we just have a severe lack of access to good medical care for our disease. So that would be maybe pushing for things, I'm just getting creative here, but like pushing for things like medical licenses to be able to like have telemed appointments with doctors more frequently across states, and not have to deal with as many, airline trips to go and travel and see a doctor for a follow-up. Those kinds of things. Nothing curative, right? We don't have anything curative in our cancer. We don't have anything with super good data and lasting durability in showing that it helps us to prolong life with metastatic disease. So just letting them know, like, again, that's a reason for research. Like, we still need research in here because this is such a dire need for the community.
Yeah, and that's when you get in there and say, like, we need a carve out for ocular melanoma. There might have been movement in this, maybe cutaneous, but what about us?
We need a big carve out of research funding to make sure that it stays focused on uveal so that we can make strides and we can make progress the same way that cutaneous has made some really significant strides. And it's been because of this kind of level of advocacy that you guys have done as a community. So I'm here to bring the message out to you guys that we have the capacity to do that too. Anyway, and then I think that maybe the other thing that would be good for representatives to know would be for them to know about the organizations like A Cure in Sight or NORD, the Melanoma Research Alliance, the places that specifically are working to help advocate for our disease. Like, make sure that your legislators are aware of those people, of those kind of players in the game, so to speak, just so that they can see that there's representation, right? There's representation out there for ocular melanoma. It's not just me, the one patient, who's telling you I have a problem. Anyway, so I just think drawing the picture and helping paint the picture in different ways sounds like it would be a helpful avenue.
Yep.
Do you feel like, in your level of advocacy so far, do you feel like this has kind of just been a little bit of like a trial and error for you, that you've had to really learn as you go and try different things each time?
Yeah, I think largely so. I've aligned with, a larger patient advocacy organization, and we usually set an agenda based on our priorities. So you set legislative priorities and move in that way. But I think as an individual, there definitely is strength in numbers. So what I would suggest, kind of going down the line, well, for one, remember this: you should never be intimidated by meeting with your legislators. They are normal people just like you that you have elected into office, and they represent you. So that's the first thing. And at all of the levels, don't feel insulted if you do not meet with your elected member. They have staffers who are health experts, and that might be who you meet with. The health aide usually knows more than the member, and that's who is going to advise the member. And I know for one, like when you go on Capitol Hill, you might meet in a hallway with this staffer, and sometimes people walk away feeling a little like underwhelmed, but the reality is that staffer, this is their job, this is their passion, this is their area, they're taking notes, and they will take it back. If you go to a regional office or a local office, right after that meeting, every week we had to put in what the issues were that came up in the region. So whatever you are taking in, it will get down to DC, to your members. So those are things that I want everyone to know, that honestly, your voice really does matter. So if you go in and take an issue, and I would suggest really just thinking about what's important to you, and you can push that forward, and then aligning with your greater community, because that's the one negative when you're in a rare disease community. It's small. They're smaller numbers. So you do have to band together and really be the squeaky wheel and let people know at each level, like, these are our priorities. This is where we need action. And we won't go away until we get action. And you just keep going in. They can't run away. You put them in office. So don't be nervous. They're not going to turn you away. Just really make sure you say, no, we're going to make sure our voices are heard.
Yeah,
and that's the way change happens.
Aura Biosciences is a clinical stage biotechnology company focused on developing precision therapies for solid tumors that aim to preserve organ function. Our lead candidate, Belsar, is currently in late-stage development for primary choroidal melanoma and in early-stage development in other ocular oncology indications and bladder cancer. Our mission is to grow as an innovative global oncology company that positively transforms the lives of patients. For more information, please visit us at aurabiosciences.com.
That's so important, and it's so cool to hear you talk about this, honestly. So, like, let's just talk a little more about some of the benefits of advocating at a federal level. Like, what are kind of the results of how that can play out? Like, I know we talked a lot about coverage, right? We talked about how insurance coverage tends to follow a specific pattern, especially when there's like new drugs or procedures that become FDA approved. So do you want to walk us through kind of the process of how that looks and why that is all federally related?
Yeah, so typically the Centers for Medicaid and Medicare Services will approve coverage over a new therapy, a new treatment, and then private insurance follows suit. So we usually go in and try to speak with CMS. So that's one reason why it's important to advocate at the federal level. If you know there's a new therapy that's coming up and you say, we as the community need this covered, then you want to go in and make sure that your member of Congress knows this is important so that they can work with
So what does CMS stand for?
the Center for Medicare and Medicaid Services.
Okay. So if, for example, you knew that there were a therapy that was Medicare approved, but it hadn't been Medicaid approved, but it is Medicare approved, then you could bring that to your state senator, U.S. senator in your state, and you could say, hey, I want you to be aware that like the community and the whole country, like we need this therapy to be available to us, and right now private insurance is not covering it like they should be, and we need some support in getting through to them.
Yes, that's exactly what you do.
And that's like, I mean, I'm not going to like go into the weeds on what I'm dealing with, but that's what I'm dealing with right now is trying to get a Medicare approved, VA approved procedure that I need my private insurance to cover. And I'm working with my legislators and trying to just figure out the best way to get the attention of private insurance for me as an individual. But what I'm hearing is that it's also equally important to make sure that it's community wide, that we need this available for our whole community. Oh, I love that.
Yeah, and you think about it, it's like as you're moving the needle, you're making sure no one else has this kind of suffer through and struggle, have those same struggles
exactly.
you have, right? And I think that's one of the things that's been important, especially in our community. Some people, you said, we have ebbs and flows with our ability. So when you have the strength and you have the help to be able to help move that needle forward, you're being able to clear the way for so many other people.
Yeah, no, it's so important. Okay, so like, I'm sure that you guys are questioning, could I be a good advocate? I think that for the most part, anyone with a rare disease, doesn't matter who you are, right, what you look like, where you
caregiver
live,
as well, your child, like everyone. Yes. We have children that come out because it's important, right? As a young kid, you have a story to tell. Mm-hmm. One of the things I say is I didn't survive this alone. Everyone in my family, my friends, right? I had a circle that survived this with me.
Yeah, we're all
and
surviving together.
Right. They all wanted to see me make it. They all wanted to see me thrive. So, bring your village.
Some examples then. Obviously, rare disease patient. So if you're an ocular melanoma patient, hate to break it to you, you're a rare disease patient.
Right.
But some of those rare communities within the demographics of your disease space. So what does that mean? Do you want to help us explain that? Like the demographics of your disease, what does that mean to people? Because I think that can be kind of a funky word that they see, like when you report demographics in your disease, what does that even mean? Like,
so your demographics are your socioeconomic status, your race, age, location, right? So demographically, I was an oddity in melanoma as someone who's darker skinned. I was younger. To present at a later stage, I'd always had comprehensive medical insurance, so that's usually not common. So I just totally fell through the cracks, right? So yeah. I'm not totally sure about all of the demographics across the board, but if you know, like, oh, I'm younger and this is a disease that usually affects older people, it's very important to get your voice out there too, because you want to make sure that your population is represented, that the concerns of your group are pushed forward.
So really, if you're one of those patients who has fallen through the cracks, then it's really imperative that you advocate the best that you can when you can.
Yep.
Wouldn't that be such a unique learning opportunity as a mom? I mean, I'm just speaking as a mom here. I've got an 11-year-old kid who has been watching me, and observing me go through an ocular melanoma diagnosis from the time he was 5.5.
Right.
Or maybe not. I think it was 6.5. So he was 6. He was going into first grade, and he's watched this his entire life. He has a stronger knowledge base around what ocular melanoma is than any of his classmates. And wouldn't it be so unique for him to have the opportunity to participate in something like Hill Day with me
Yes.
Assuming I could find a day at a time that I could take him to go and do that. But just to be able to stand in front of the legislature and demonstrate, like what you said, this doesn't just affect me. This affects a whole lot of people in my community, and that has an impact on really what we as a community of people can even do.
And if you can't get there, for him to send an email or a letter or a
Yeah.
picture and say,
Or
this
like
is my
even,
mom.
and I mean, wouldn't it be a cool project, like to even pose to like, a fifth grade class or a seventh grade
Right.
class to just say, hey, could you guys help me advocate to the legislation? Can you help write letters? Like you give them a template and then the teacher works with you. Like that would be such a unique project.
It would be not only unique, but very powerful.
Yeah, I think that would be super cool. Okay, well now that's going on my list of what am I going
I
to
think
ask
it
my
should.
fifth grade teacher to help do.
I think it should. I love it.
No, I think that would be so amazing. And like you said, I think it would be really impactful. And I think that it would be really neat for these kids to see like that their voice matters. And I think
Right.
that, at the end of the day, isn't that what we all want to believe in government is that our voice matters.
Yeah. Learn early.
Learn early, yes. Okay, so the cost. What is the cost? The lack of progress, like we talked a little about, there's some repercussions, right? Our whole family suffers if we don't have curative options, if we don't have good treatments, we don't have coverage. It's not just me who's suffering, it's my entire family. And that means that, by extension, my community is suffering.
Right.
What does that mean, kind of in a community scale? Like how does that even get pulled into? Because it doesn't seem like it would be enough, like to just say, well, like my family can't work the same way, or like we're all just really stressed. Like what do we talk to them about or just have a good knowledge of around this kind of real world cost of disease?
Well, interestingly, that's very important in policy. So real world data, the real world effect, the cost of disease is what moves numbers. And that's what influences coverage for new therapies when we're thinking about the upfront cost and investment versus long term. So if you think about someone who is diagnosed with a disease and you have a treatment that is curative or stops it from progressing, well, in the long term, you're less of a toll on the system because you're able to work and produce and contribute. So you're not taking in disability payments or some other social service money. You're not costing your insurance company as much either because you're out of their hair. You're healthy now, stable. So when you let your legislator know, or if you're writing a letter to insurance and you're putting forth, this is actually the cost of my disease so far, or this is the projected long-term cost if you don't cover this now, then those are real world numbers, and that's what they understand. So it's very valuable and important to be able to tally that up, to say if you invest now, this is what I'm saving you by investing in our treatment, our cures now versus long term, trying to piece together. And one of the things, and I don't know if you are familiar with like step therapy or fail first, where it's like in oncology we don't usually have that as a legislative issue, but where you have to fail on this treatment first before they'll approve the next one, right? But what's the cost of that? So making sure that we're investing up front.
Well, and even like in a simpler breakdown, like just with imaging, right? We know that with imaging, most of the time, if you have something questionable on a I don't know, like an ultrasound or just something that shows up on the skin, and you're just like, ooh, I've got something kind of funky that I feel here. Most doctors aren't going to go straight to an MRI. They start with the kind of bottom of the ladder, so to speak,
Right.
and then they move up the ladder. But if you think about it, if there were a better way to know, well, is this something we need to image with an MRI, then wouldn't it cost less to just go straight to the MRI as opposed to going ultrasound, CT, PET scan, then an MRI? Like all of those imaging, modalities have their own costs associated with them. And so to me, it's like it's more costly to go up the ladder sometimes than it is to actually just proceed with what we believe to be the best option. So, I mean, there's so much to talk about. There's so many things that we can advocate for. But Jackie, I think just to kind of sum up, like, what do you feel like you would want people to take away from the most, like just from listening to our conversation?
Sure. I think the most important thing to know is your voice matters. Your voice matters. And the only way that you will make change is by sharing your voice, by sharing your story. So whatever it is, I know some people are scared to speak publicly. Some people are scared to engage and share their story and not always comfortable with sharing. But that's the only way you'll make change. It's important to know a lot of times our elected officials have never met someone with your disease, have never met someone that's had your experience. So imagine the impact that you can have if you get in there and you say, this is what someone living with X looks like, and this is what I've been through. And I don't want everyone else who's diagnosed with this to have to struggle and suffer the way I did when we can make a change. And so that's what's most important. So just know that your voice and your story matter. And it is critical that you get out and share in order for us to make change.
I love it. Jacqueline, thank you so much. And just to kind of sum up from what I just heard from you and from what I've heard from this entire conversation is that surviving isn't good enough. I mean, if we can communicate that to our legislators and just get it up the line and just keep putting it in front of them, keep being the squeaky wheel, like Jackie said, then there is the potential for change to happen sooner than later. I think that we can agree that change will happen eventually over time. It's just a matter of how squeaky can we be.
Right. Be a part of that change. Help usher it forward. Yeah.
All right. And even just trusting that the small actions can help too, right? If you don't have the capacity this year to do something big, like go to a hill day, then don't let that dissuade you from getting involved in smaller ways, finding out other local level ways that you could benefit the whole community with ocular melanoma. So anyway,
send an email. Those are the easy, approachable ways. Just send an
use
email, a letter, make a phone call.
Use ChatGPT and say, write me a letter to my congressman about this. And then you don't even have to do it. You just have to look through it and make sure that it makes sense. And obviously put in your own personal story. But there's so many resources out there on the internet, you guys. And we have such a big capacity for impact, even though we are a small community. So anyway, Jackie, thanks for helping us spread this message.
Yeah, one more thing. No one can tell your story better than you. So remember that.
Oh, that's probably
Most
the
important
best thing to pay attention. No one can tell your story better than you, Jackie. Jackie has quoted it. It is now Jackie's quote. It will forever live. Will forever live here on the podcast. Well, you guys, thanks again for those of you who subscribe, who are listening to this. Thanks for sharing this video. If you can just share it with another friend, just help somebody else learn a little bit more about advocacy and how this doesn't have to be complicated. And Jackie helped break down some of the best ways that you can get involved and the organizations that you can get involved with so that it's not all on you. But thanks for joining us today, and we'll see you next time.
Bye.